Hi, I'm Dr. Jay Varmint, and welcome to Thermometer. On this channel, I check the temperature of health in the United States and around the world and give you expert insights on infectious diseases and public health. I'm pleased today to welcome my friend and colleague, Dr. John Epstein, for our weekly episode called Inside Bird Flu, where we discuss the latest news about the H5N1 epidemic here in the US and around the world. How are you doing, John?
I'm good, Jay. It's good to see you. How are you doing
Yeah.
this week?
I'm doing well. It's great to check in every week about H5N1. I think the news has been relatively quiet here in the United States, which is a good thing.
Yeah.
But there are some concerning signals around the world, and of course, very close to us is Mexico. And one of the interesting and important bits of news this past week is that the World Health Organization reported about the first death in Mexico from H5N1. And this, unfortunately, was in a 3-year-old girl from Durango State. According to WHO, the child didn't have any underlying health conditions and became ill on March 7th with a fever, malaise, and vomiting. She was then hospitalized for 6 days later for respiratory failure, was treated with antiviral drugs, but unfortunately, after transfer to a tertiary care hospital and several weeks of hospitalization, died due to complications of H5N1. Along with the initial findings of like what they called an unsubtypable influenza A virus, she also had looks like a co-infection with parainfluenza 3. And the interesting thing about the H5N1 analysis is that the genetic sequencing revealed that the virus belongs to the D1.1 genotype. And that genotype has been linked to serious infections in humans in the United States and in Canada. The other interesting thing about this is that, they did contact tracing of 91 people that were linked to this girl and found no other infections at all. And so nobody actually understands how this child actually got infected.
Yeah.
There haven't been any reports of poultry outbreaks in Durango, although there were some H5N1 detections at a zoo nearby. As well as they said in Canadian geese and in a bird from a park in that same state. So, John, it's kind of a mysterious and obviously very unfortunate case. What are some of your thoughts about it?
Yeah, it's always tough when you don't know where the exposure came from. Is it possible that she was exposed from another person who was infected? And perhaps if it was an adult and they weren't, highly symptomatic or they had mild symptoms, but were still able to transmit virus, that's one possibility. Being at a zoo where some of the birds on exhibit were infected, there's so little contact generally between the public and zoo animals. It's hard to imagine a 3-year-old would have had much direct contact with an infected bird or excretia, but you never know. But in any case, it's important to understand how people get exposed. And in this girl's case, they need to get to the bottom of it because either it's person-to-person transmission or she had exposure to an infected animal.
Yeah, and when we think about flu, I mean, I think one of the reasons it is such a complicated disease to track is because these birds fly, right? And so, unlike a lot of other diseases that in humans, where there's you have to directly come into contact or be somewhere in the vicinity, like in the same room as people, obviously a bird, that was sick could theoretically, poop in the area or vicinity of the backyard where the child is playing and get infected
Mhm.
that way. I have to assume that that's a possible route as well.
Yeah, and we have to keep mentioning too, there is spillover happening to wildlife. So was there another local animal, that could have been infected that she might have had contact with? Maybe there were feral cats in the neighborhood that she played with who were infected. I mean, there's so much of this we don't know. It's very sad though to hear about a 3-year-old, getting infected and dying from this.
Yeah, and do you know anything about this genotype? There's this a concern that this genotype has been linked to severe illness. I tend to be a bit suspicious of data like that until I've seen a large enough sample size, because of course it just could be happenstance that the cases that got those infections happen to also have medical conditions that put them at risk. Even a 3-year-old may have some susceptibility that to severe
Sure.
illness that we don't know.
Yeah.
But do we know anything about that genotype and why it may or may not be higher risk than others?
I mean, this particular type of H5N1 has been associated with cases in the United States and I think in Canada that were more severe. And so that, we're getting there in terms of numbers of cases. Most cases have been fairly mild. You see conjunctivitis, um, but there have been some severe cases for sure. And so those have tended to be this kind. So we need more data. And fortunately, there's enough testing and sequencing that's going on that we're starting to understand the associations of which genotype is associated with which case. But you're right. We need to continue to see more data to really understand how much more severe it can be.
Yeah, and that sort of links me to the next question, which is sort of new data that's come out. And this is not data about H5N1 and how it causes diseases or how it's transmitted, but it's how people don't really seem to care about this. And I
Yeah.
say that laughing because you and I are doing a weekly show about it, and we obviously care a lot about this problem. But there's some new data out from the City College of New York's Public Health School, which did a survey of 10,000 Americans. And the survey had some worrisome, but sadly not very surprising findings. They found that only 26% of the people that they surveyed knew that people can actually get infected with H5N1. So that means like 75% of people thought this is a disease of birds and birds only. So
Mhm.
that's problem number one. 62% agreed that the virus could be a threat to human health, but only 27%, so 1 in 4 people, thought they themselves were ever at risk of getting infected. And unfortunately, 54% of the people didn't even know that pasteurized milk, that is like a basic component of our food safety, 54% didn't know that pasteurized milk is actually safer than raw milk. So, John, what do you think about this?
There's so much to unpack here, Jay. It starts from we can't necessarily expect people, everybody, and particularly, people who are not technically knowledgeable about disease to inherently know that bird flu can also infect them or that it's happening in the United States. It's been on the news to some degree, but what this really is showing us is that unfortunately there's a widening gulf between the scientists who are very concerned about H5N1 and have been for decades as this being a potential cause of a future pandemic. I mean, let's remember influenza epidemics and pandemics have historically gotten bad. And we look to those because they're respiratory, because they're, transmitted, because the birds that carry flu viruses occur globally. There's really opportunity for widespread spillover and transmission. And we're really seeing the tip of the iceberg here. So there's serious concern amongst the scientific and public health community. The problem is that's not being communicated to the public effectively. And to me, it's a combination of the unfortunate outcome of a real, fissure, a fracturing of trust between the public and the government and science from COVID. And it isn't like COVID was crying wolf. I mean, it was a pretty serious pandemic, but for all the reasons we've been discussing, that the communication was problematic. People felt that the control measures were overly onerous. They felt that there was different information being conveyed at different times and from different sources. So all of that can be very confusing. And now I think we're seeing some fatigue in the public from really taking on information about health risks. So they just simply don't perceive H5N1 as a risk at this point. And the other thing is we have an administration right now that is systematically dismantling the capacity in the United States to do surveillance and detect this disease, to report on it, and to communicate findings to the president and to the public. And we just don't have a voice coming out of our federal system saying, hey, this is something we're treating as an urgent situation. We're doing our best to control it. We're doing our best to monitor it. And here's what you need to know. Instead, you have actions that are undermining the very, folks at CDC and FDA and USDA that would normally be working on this. And so information is a little more limited and it's coming out a little more scattershot. So I don't think we've yet heard a real organized message that this is something to worry about. And here's why. Now, the last thing I'll say, and we should talk about this, is that the general sort of statements that have come out of big public health entities like CDC and WHO and the animal equivalents, which is the UN Food and Agricultural Organization and the World Organization for Animal Health, those are two intergovernmental agencies that also monitor animal disease, have generally assessed this as low risk globally to people. So not wanting to be alarmist here in any way. So general population, low risk, unless you're in an occupational situation that puts you in regular contact with animals that could be infected, i.e., working on a poultry farm or a dairy farm in the case of the United States.
Yeah. So this is I mean, there's a lot to unpack here, obviously, and you did a great job just now summarizing like the range of issues that we face. And, I have a few thoughts first. One is, this survey was actually done in the fall, before the Trump administration officially took over. And at that time, one of the other findings from this survey that really emphasizes your point is that at the time this survey was done, only 40% of people said they trust CDC and FDA. Now, I used to work at CDC, and the federal government used to do, and I think hopefully we'll still do, hopefully it hasn't been doged, still does these annual surveys about trust and
Mhm.
respect for federal government agencies. And when I was at CDC for 20 years, CDC consistently had something like an 80% approval rating. It was one of the most trusted. I think the US military, armed forces, were probably the only other agency trusted more than CDC. So this suggests that only about that's been cut in half. And now this was done before RFK and Trump and all of the
Yeah.
cuts that have been done.
So
And
it can
so
only have gotten worse, I imagine.
that's the issue, right? Like you highlighted here how much people are not trusting institutions. What is it right now? And what's that going to mean if and when this eventually spills over into humans in a much more sustained and dangerous way?
Yeah, and it's so critical. COVID, I think we're still doing the post game analysis on how it was handled and how it was messaged and what we could have done better. And that'll be important to do. And we should be honest about our shortcomings, as a country and in public health for sure. But we're going to keep being faced with infectious diseases. There are going to be outbreaks. A lot of them are going to grow to large scale epidemics, and some of them may even become pandemics. So we have to find a way to restore trust both in government and international systems, but really in each other too, and certainly with the scientific community. So for you and I, Jay, that means doing a lot more of what we're doing now, which is trying to really share trustworthy information to the public, but also getting out there and engaging much more to try to restore that trust, because we're going to have to work together if we're ever going to control future epidemics.
Yeah, I mean, I do worry a little bit about people's fatigue, right? You face this with climate change and other big picture problems that you don't want people to be worried on a day-to-day basis, because there is sort of a limited reservoir of worry.
That's
Eventually
true.
people say it's not going to be a problem anymore. But I do wish people understood the threat to food safety, to food prices, and to pet health. Right. So
Yeah.
even if they weren't worried about their own human health, which is a rational approach at this point, right now, cases are very limited. There is no sustained human to human transmission. At a minimum, people should be concerned about this disease because it is threatening the safety of certain food products, particularly raw food products that are served to humans or to serve to pets. It is a danger to pets themselves because they can get infected either through a food source or from exposure to animals in the wild.
Right.
And it is clearly impacting our food prices. That is one of the most important reasons why the price of eggs rose so much last year.
Absolutely. And it's true that I think also most people get their information from experience and from individuals they personally know and trust. And that occupies a large part of their sphere of information. And because some of these diseases like H5N1 are historically rare, I mean, we think about them a lot, but in general, they're pretty rare and they're not in people's consciousness. There isn't really a perceived risk at this point. Most people don't know someone else who's been infected by H5N1. You can't say that about COVID,
Yeah.
but certainly for this virus. So I could understand why the perception of risk would be pretty low right now, which is why you get parts of the survey that say, a chunk of people aren't willing to change their dietary habits, even though unpasteurized milk is less safe than pasteurized milk, or they're not going to change, the way that they consume meat or have exposure. So we have some work to do, but it's understandable that people don't perceive this yet as a big risk.
Yeah, no, and I think that's a rational approach, but I do think, raising sort of the drumbeat of alarm about these other, risks is going to be important as well, and people recognizing that the link that, the link, the chain between what's in the wild, what's in our food system, and what's in their pets and what comes into our homes. But I have to acknowledge that I myself am guilty of some, cynicism, apathy as well. I know, John, and you and I were talking a little bit earlier about another big international development that's happened in the past week related to this, which is the negotiation of the first pandemic treaty.
Yeah.
And so I'm going to ask you in a moment to give us a little summary about this, but just to bring people up to what we were talking offline was that I haven't really been following this. And to be honest, it's because I'm very cynical about the impact a treaty might have, especially with the US
Yeah.
and with a few other countries like Russia, et cetera, essentially no longer engaging in the global health system. So, John, tell us a little bit about the pandemic treaty and why all of us should care about it.
Okay, that's good, Jay. And it is something that probably most people aren't paying attention to, but it is a big deal in global health. And I'll tell you why. Historically, the reason we have an entity like the World Health Organization is that we acknowledge that there are health burdens and risks that we all face as a global community. They're not specific to any one country. And in order to improve the quality of life, people's livelihoods and health, we need to work together as a group of countries, as a group of nations. And so people who participate in the World Health Organization, who support it, who subscribe to it, which is not the United States right now, but we have been historically, is recognizing that we all benefit when we work together to improve the lives and livelihoods of people, especially those who are most vulnerable around the world. And so one of the, we're talking about fracturing of trust and loss of trust in systems during a crisis, during a global health emergency. We rely on leadership from entities like the World Health Organization, but also from Western and industrialized countries like the United States, like their European Union as a collective, the UK. And what often happens is that in response to a public health crisis, drugs and vaccines tend to get produced, manufactured, developed, invented in countries that have a lot of resources to put towards research and development. One of the real issues that arose during the COVID pandemic was that the vaccines, which were developed and manufactured in the United States and the UK, weren't very quickly provided and distributed to low and middle income countries that didn't have the ability to manufacture their own drugs and vaccines and were dependent on us for access. And that access was slow to come. There were struggles between our government and private sector pharma companies that created the vaccines, that had patented the technology for the vaccines, and there were issues in terms of sharing the technology. So why is this pandemic treaty important? There was a real recognition that should this ever happen again, a global crisis, a pandemic that really requires global distribution of goods like vaccines, like drugs, like technology, it can't go down the same way it did with COVID. It can't just be the wealthy nations that create and benefit from protections while the rest of the world suffers. And so part of this pandemic treaty, which is really only the second major treaty the WHO has ever signed, that ever has been agreed to. And this just happened last week. 191 member countries agreed to, number one, an agreement where in the next situation where there's a pandemic, where drugs and vaccines are manufactured, there is provision in there for rapid sharing, not only of the products themselves, but the technology to manufacture those products very quickly. When pathogens are detected, when a new virus is discovered that's causing a disease, the genetic sequence will be shared immediately across the different countries. Okay, any information that could be useful for developing therapeutics or vaccines will be shared rapidly. This was inherent in the agreement, and that was a big, big deal. And believe it or not, it took 3 years of negotiations to get to a point where everyone could agree on a way forward with this. So that's one thing. Technology, drugs, and vaccines. The other thing that was really important in this treaty, and it might not get talked about quite as often, is that typically responses in crisis have focused on things like detection of the pathogen, control of the epidemic in human populations, but there's never really been much attention paid to real prevention. And what I'm talking about is spillover, recognizing that most pandemics will be caused by viruses that are carried by wild animals that will jump into livestock or into people directly and spread that way. We have often ignored the point of emergence, the point where that first person or group of people gets infected from a virus carried by wild animals and then goes on to spread it. And in ignoring that, we are often way too late to the party when it comes to trying to control and contain epidemics. Now, in this pandemic treaty, there is real language saying that participating countries will make all reasonable efforts, of course, if resources are available, to focus on prevention using a One Health approach. What that means is recognizing that there's a real interconnectivity between wildlife health, and that includes some of the viruses that might be circulating in wildlife that have the ability to spread to domestic animals and people. It will mean paying attention to livestock health and recognizing that those things influence human health as well as does the environment around us. So there's language in this treaty that really urges spillover prevention for the first time in history. And that is a big deal because a lot of us have been advocating for this as an approach to pandemic prevention, disease prevention for a long time. But it's a tough sell because it costs money to really understand how viruses spill over and emerge in the first place.
Yeah, no, this is one of these situations in which it's very easy to poke holes in anybody saying, well, it's important that we have a treaty. So let me just throw a couple of the holes out there, but then I'm going to also rebut my own argument, which is one, this isn't binding. There is no enforcement mechanism, right? WHO does not have the ability to impose economic sanctions, let's say, on countries that don't do it. So that's the argument against a treaty. The argument then in favor of it is, though, that countries don't like being called out, right? Diplomacy has just like it is in whatever organization you work in. If you call somebody out in a meeting for bad behavior, even if you don't suspend them from work or hold, dock their pay, people respond to that and act better. So even if there isn't a financial enforcement mechanism, simply being able to say publicly that you violated a treaty has an impact. That's one issue. The second is, well, there are no resources being put into implementing this, right? And especially resources are being pulled away. The US is pulling away. The UK is pulling away. Russia, all these organizations are pulling away. But at the same time, there is a lot of money out there in the world. It doesn't necessarily just come from wealthy countries that could be deployed or reallocated to this. And so this does also provide a sort of endorsement of efforts, whether it's from philanthropy, whether it's from low and middle income countries, to allocate resources towards these very critical interventions like spillover prevention and One Health.
That's right. And it represents an acknowledgement that things weren't done very well with COVID with respect to vaccine and therapeutic distribution, globally. And now this treaty will actually lay the groundwork for more support to go into low and middle income countries to manufacture and develop their own vaccines and drugs locally with international standards. So it does, although there isn't anything binding to this, but there are resources that will be made available to, let's say, help Africa develop vaccines and distribute within the continent rather than relying on the United States or Europe. And the more that happens, the more distributed we can be about the development and manufacture of drugs and therapeutics, the better off we'll be in the next emergency.
Yeah, and without question, and I think for everybody out there who's obviously interested in public health, interested in these issues, they realize that this is an ongoing attempt to improve the way humans work together around the world. I do get frustrated sometimes when people are like, well, you screwed up and you're never going to do it again. Each new disease is a new disease. It is not something we've ever faced before. It is functionally the equivalent of an alien landing on Earth, and us having to figure out how we interact with it. So it is important that there be retrospectives and reassessment and reanalysis and a change in the way organizations work, in the way funding is allocated, in the areas that we invest in, and that's a good thing. So I know some people look and say, "Oh, look, people are admitting mistakes and they're doing things." Of course, we all are. We're humans. We are highly fallible people. But it's great to see that there is an attempt by the global community to at least agree on a common set of areas in which we all can agree that we need to improve without the sort of conspiracy thinking and sort of emotional grandstanding that tends to occur when people who want to dismiss everything that happened during COVID as somehow harmful.
Sure. And I have to think that there was some sense of satisfaction that even in the absence of the United States, which, don't get me wrong, I mean, we should be part of this, we should be contributing to global health efforts. But even in our absence, countries were able to come together and formulate a plan and agree on that plan. And I think that's also important to bring up, that they're doing this even without what
Yeah,
historically has been the biggest contributor to global health.
it is. Although the cynics would argue that that's probably why it actually happened.
Yeah.
So that's a topic for another, maybe over a drink and not on camera to talk about.
I know. Well, we'll see how it plays out. Now, the other important thing, and people want to pay attention to this, is that it will be officially ratified at the World Health Assembly next month. So the language of the treaty was agreed to. That was a big victory, but it now becomes official next month when the World Health Assembly gets together. These are the health officials from every country who meet
Yeah, that's really interesting. I
and
have
vote
no
on this.
idea whether I think and this is we should look into this so I may educate our viewers on it is, the US announced that it's pulling out, but that is a long process. It doesn't happen immediately. And I have to assume the US is not going to give up its seat at the World Health Assembly this time around, because it gives them an opportunity potentially to, I don't know, scuttle some of these discussions. Well, we'll wait and see what happens in a few weeks.
All right, well, stay tuned. I'm sure we'll talk about it here when it does.
Absolutely. Okay. Thank you all very much for watching this episode of Inside Bird Flu. If you liked what you're listening to and you're enjoying this, please hit the like button. Please hit subscribe, and look forward to seeing you next week for another episode of Thermometers Inside Bird Flu.
Take care.